Female infertility. Investigations we have done for female infertility is test for anovulation and HSG. Female infertility causes are ovarian causes, tubal causes, uterine causes, cervical causes and unexplained causes. Ovarian causes: hypogonadotropic hypogonadism causes Kallmann syndrome. Normogonadotropic normotropic causes PCOS. Hypergonadotropic hypogonadism causes primary ovarian insufficiency. Test for ovulation. If test which tells ovulation has occurred is cervical mucus study, vaginal epithelial study, serum progesterone levels, basal body temperature monitoring, endometrial biopsy. Test which predict ovulation, urine LH kit and follicle monitoring. Management for anovulation is for PCOS it is letrozole. Other PCOS is clomiphene citrate. Drug of choice for anovulation in pituitary ablation is HMG. Drug of choice for anovulation in Kallmann syndrome is GnRH analogs, which is pulsatile manner. HMG human menopausal gonadotropic. It taken from urine of postmenopausal female. It contains 75 units of international units of LH and FSH. Indication is anovulation and induction in pituitary ablation used for ovarian stimulation in IVF cycles. Trigger which is used in ovarian stimulation is HCG. Drawbacks is multiple pregnancy. Ovarian hyperstimulation syndrome. Ovarian hyperstimulation syndrome is highest with chances of HMG, least with clomiphene syndrome, absent with letrozole. In ovarian hyperstimulation syndrome, more number of follicles are present. Due to more number of follicles, when we give HCG, follicles rupture. This can lead to release of vascular endothelial growth factor more. This can lead to vascular permeability increases. There is capillary leak. Due to this, fluid collects in the third spaces. It causes ascites and hydrothorax, and it also causes hemoconcentration, platelet aggregation and thrombosis. Ovarian hyperstimulation syndrome grades. Grade 3 on USG, grade 5 grades are present. On grade 3 on USG we find either ascites or hydrothorax. Grade 4 clinically ascites present or hydrothorax present. Grade 5 clinically both ascites and hydrothorax and decrease in renal perfusion. Ovarian hyperstimulation syndrome, there are two types, type 1 and type 2. Type 1 means less than 9 days, type 2 means greater than 9 days. There is an exogenous HCG injection, HCG. Endogenous type 1 there is an due to exogenous injection of HCG. Type 2 is endogenous in HCG. Management. Type 1 management is decrease in avoid strenuous exercise, avoid weightlifting, avoid intercourse. Treatment is analgesics. Late onset OHSS is admit and correct the electrolyte imbalance, IV fluids, prophylaxis for thrombosis, paracentesis for ascites, and to decrease vascular endothelial growth factor we got cabergoline. In primary ovarian insufficiency, there is no more follicles, decrease in follicles. So we have test for ovarian reserve. Ovarian reserve we will test when there is female of patient greater than 35 years or a past history of ovarian primary ovarian insufficiency or previous history of radiotherapy or family history. It includes anti-Mullerian hormone, inhibin and estrogen levels. Most important best is anti-Mullerian hormone. Management in ovarian primary insufficiency is IVF plus donor eggs. Tubal factors. Infertility. For infertility these are salpingitis, pelvic inflammatory disease, endometriosis. Investigation of choice is HSG. Gold standard investigation is laparoscopic chromoperturbation plus hysteroscopy. In tubal blockage there are two: complete unilateral or a bilateral block. Unilateral block treatment is clomiphene citrate and IVF. Bilateral block there is proximal block and distal block. For proximal block it is also known as bilateral block. We can give hysteroscopic cannulation, laparoscopic chromoperturbation, and best treatment is IVF. For distal block, during laparoscopy, if there is mild block we can give fimbrioplasty. There is major block with presence of hydrosulfings or without presence of hydrosulfings, treatment will be IVF. In presence of hydrosulfing we can give a salpingectomy. For cervical causes, there is cervical antibodies which anti-sperm antibodies which decrease motility of sperms. It is also known as immunological cause of infertility. Management is clomiphene citrate plus IUI. Unexplained cause of infertility is clomiphene citrate plus IUI. If it is fails more than 3 times, we give in vitro fertilization. In cervical factor of infertility, the test we done is postcoital test.